let's look at some of the ideas behind the health question. Now, earlier we looked at the demographic transition. This has been accompanied by something called an epidemiological transition. This is characterised by a fall in infectious and acute diseases and an increase in chronic and degenerative diseases. High death rates from infectious diseases are commonly associated with poverty, poor diets, and the limited infrastructure which is found in the least developed countries. But now, alongside these, many such countries are also experiencing a rise in chronic diseases. Evidence from international epidemiological research is showing that health problems associated with wealthy and aged populations are affecting a wider and wider swath of the world population. And over the next 10 to 15 years, people in every world region will suffer more death and disability from the non-communicable diseases, such as heart disease, cancer and diabetes, than from parasitic and infectious diseases. In addition, as both the proportion of older people and the length of life increase across the world, other key questions around the provision of healthcare are being asked. In particular, how population ageing will increase the frailty and morbidity within the population, and how healthcare infrastructures and policies can adapt to these new demands. One of the key questions you may want to look at is whether these falls in mortality, which we looked at in the first module, are going to be accompanied by falls in morbidity, that's disease and disability. There is currently evidence that through healthy living and disease prevention, the onset of disability is being pushed further and further, well back into our 80s. Will, however, these gains in healthy years continue as we increasingly turn to science and technology to extend our lives? Or will the modern drivers of longevity not only increase life expectancy, but also enable us to live for longer and longer with disease, disabilities, and frailties? Some people are arguing, for example, that we are potentially heading for a future where we're able, through science, to keep people with chronic conditions alive for longer and longer. And if this happens, how are we going to refigure our communities, families, and societies to support these new, extended, but possibly frail lives? A second challenge you may want to consider is the need to maintain health among older populations for as long as possible, thus reducing the requirement to provide and finance long-term health and social care. Let's look at the impact of population ageing in addressing this aspect. It is going to hold particular challenges for the provision of health and social care in three main ways. The amount of ill health and disability is likely to increase, the type of health is likely to change, and importantly, the effect of the decreasing numbers of younger people is going to reduce those able to provide care. If we look at each of these in slightly more detail, the total amount of ill health and disability in the population is going to rise because as societies improve their population life expectancy, so the proportion of the population with serious health problems is going to increase. This has been called the Epidemic of Frailty, and it's because the increasing number of individuals surviving to experience increased frailty and dependency is associated with advanced old age. And there's also evidence of a change in attitudes to and demand for healthcare provision. In particular, the wider effects of income, lifestyle characteristics, and new technology are driving up the demand for new advanced medical applications. The second issue is changes in the type of ill health, which are going to move from acute to chronic conditions, and these are going to exert pressure for a major shift in the allocation of healthcare resources and the configuration of healthcare services. And this will arise from the shift from acute infectious diseases to complex, chronic, long-term ill health and disability. We call this the chronic disease burden. And there's going to be a need in both advanced and emerging economies to reallocate health and social care resources away from infectious and acute medicine towards preventing and managing late-life chronic disease. And the third factor you may want to look at is the impact of population ageing on a society's capacity both to provide workers to care for an older population and the tax income to finance this. And in addition, demographic change is going to reduce both informal family care through reducing the availability of children and thus young members to provide such care, and formal care, as the provision of overseas migrants, who currently provide a lot of healthcare in advanced economies, becomes reduced as their own societies start to age. And of course, This is going to occur at a time when the epidemiological transition towards labour-intensive chronic disease is going to increase the need for hands-on care.